Hey everybody, this is Dr. Cohn. I am spending this week making some videos, and it's a nice rainy day here in Dallas. I'm spending some time talking about the heart today. I wanted to just run through some of the symptoms of a heart that's hungry for some nutrition, and it doesn't have enough of the nutrition that it needs for optimal performance. And as I mentioned in another video, you can go to the medical doctor and they can run some tests and come up with some, hey, everything's okay, which is reassuring. You don't want to find out that, hey, you have had a heart attack, part of your heart muscle is irreparably damaged, or some of the more serious stuff. But I commonly find that people get the okay, that there's nothing seriously going on with the heart, and yet they seem to be having some heart symptoms. That is where I come into play. That is where we find some nutritional things that are needed for the heart. And when you supply the heart with what it's hungry for, symptoms clear up. It's as simple as that. So what might some of the symptoms be? I'm going to run down through some of the things that I see are symptoms when the heart is having some stress because it's lacking some of the nutrients that it needs. One of the things I notice people have is a sensation of pounding, and they hear their heart. That is not a good thing. You should not have awareness of that. I do see a lot of people having some pains in the shoulder. It tends to be left shoulder, left elbow, and left hand, fingers. And symptoms in the shoulder are generally kind of a deep, hard to pinpoint pain, or in the elbow, my elbow's hurting for no obvious reason. For the fingers, it is often a symptom of kind of numbness, and worse at night. It is more common on the left, but I do see it sometimes on the right. Sometimes we'll say my right shoulder seems to be bothering me. I don't know why, I didn't hurt it, or I'm getting some tingling and numbness in the right hand, or sometimes both hands. So when that's going on, I immediately am suspicious that the heart is needing some nutritional support. And it's not complicated. We just need to find out what nutrient it's hungry for and support it, and symptoms usually clear up. But if you're having any symptoms in your shoulders, in your elbows, or in your fingers, for no reason, no accident, no injury, you didn't fall down the stairs, and yet your hand is starting to hurt, or your hand is starting to feel numb, it's generally a nutrient deficiency for the heart. Let's see, what else? As mentioned in another video, men need a strong heart muscle to have an erection. So if there is some erection difficulties, or ED, then generally it's involved with the heart. The heart is a master. It's the big troublemaker for hearts lacking some nutrition, so it causes some pain somewhere else. So anytime someone says, I have a pain for no obvious reason, low back pain, pain in the shoulders, arms, even pain down the legs into the knees, I wonder if it might be involved with the heart. So pains that start to pop up for no obvious reason are usually signals from the heart that it is hungry from something, and it's starting to put a grip on some of the muscles throughout the body, and the muscles start to get tight, and when they're tight, they're painful. So massage is helpful, chiropractic care is helpful, acupuncture care is helpful, but more often than not, the heart is hungry for something. And if you find what it is hungry for and supply it, then the symptoms clear up. So spinal pain, arm pain, sometimes leg pain, tends to be stuff that's more on the left side of the body. If someone says my left foot is hurting me, my left knee is hurting me, my left eye is hurting me, and my left shoulder is hurting me, I almost always think that there's something going on with the heart, although it can cause symptoms on the right side of the body as well. Also, just a generalized fatigue is usually present. You don't feel like you want to exercise, out of breath, feel like you're tired even just going upstairs. And remember, all of this can have a thumbs up from a medical test. Looks like your heart's okay, EKG's okay, you haven't had a heart attack, but that does not check for the nutrients being low that the heart's hungry for. So it's like asking a horse that's starving to go do stuff. It's not going to be a very well-performing horse. It's not a very good performing heart either. So just feeling tired, I don't want to go exercise. Or you push yourself to exercise and you're wiped out for a week. This is not a good time to start training for a marathon if your heart is hungry for some nutrient. It's not a good time to go to the gym. You're going to end up being either exhausted or you're going to hurt yourself and get a sprain. More symptoms at night. sometimes people don't notice these things, but when they lie down at night, then their legs start moving. Then they can't rest. They wake up multiple times at night. Their heart is keeping them from resting deeply because the heart is saying, "Hey, I'm starving here for something," and so you kind of wake up out of a deep sleep for no reason. There is a reason. It's hard to figure out what the reason is. So the heart is a mischief maker. If I could support one organ in the body, there's many important organs. The thyroid is very important for overall wellness. The heart, the liver, the kidneys, digestive tract. But it usually comes back to, in the order of things, support the heart first. And if the heart's okay, then we can go on to working on other organs usually. But save the heart, get the heart the nutrition it wants is the priority of the body. Because you can have some trouble with the intestines, you can have some trouble with the thyroid, you can have some troubles with the heart, and if you have troubles with the heart, then then it's more serious. So people can get by with minor problems in other organs, but the body and the nervous system has a priority. Can you help with the heart first? And so I see that a lot on first visits where people lay out their complaints and we try to find out where to start. Frequently is with the heart. So it causes a lot of things, including generalized fatigue, sensations in the chest, pressure in the chest, pressure in the arms, numbness in the fingers, numbness in the feet, circulation problems, trouble with exercising. A lot of stuff. I could go through many more symptoms, but that's the top few. So if any of this is ringing a bell, consider getting some more in-depth testing done for your heart that's a little bit more in-depth than simple EKG or the things that the medical doctors are doing. I'm here if you need me. I'm in the North Dallas area. My office number is 972-880-8541. I'd be happy to check to see if there's some nutrients missing that might help with the function of the heart. And if you like this information, please subscribe to my channel. Give me a thumbs up on some of the videos, and drop me a line if you have some questions about what I'm talking about, or if you have a request for a particular topic. Try to do a video about it, and I'll see you guys on another video.